Hi, my name is Laura Guerra-Cardus. I'm with the Children's Defense Fund of Texas. We're here today to express our strong support for children's health care coverage and ask that the legislature take action this year to reverse a troubling trend in child uninsurance rates. Texas has the highest rate of uninsured children in the country, and in 2017, it got worse after a decade of improvement. The single most effective thing that we can do to reverse this trend is to implement 12 months of continuous coverage for children in Medicaid, just like we do in CHIP. Children's Defense Fund of Texas helps families enroll their children in Medicaid and CHIP, and since the implementation of the monthly income checks, we have seen significant confusion among families. I'm happy to give more details of the current system during questions if you would like. Some of the top issues we have seen in the field include confusion about renewals versus periodic income checks causing eligible children to lose coverage, delayed receipt of letters and inadequate time to provide verifying information, eligibility system error, and issues for families with fluctuating incomes who may lose coverage depending on whether an income check happened during a good month. We are currently working with a family whose son was diagnosed with leukemia and risks being cycled on and off coverage. The implementation of these periodic income checks, which started in 2014, has essentially increased the number of times children can fall through these kinds of cracks from 1 time a year to 5 times a year per child. Some families do not have their children aligned in the same renewal periods, and that significantly increases the problems that we see. Additional reasons we should care about ensuring children can keep their coverage include increasing uninsured rates will be most felt in rural areas where hospital budgets are tight and absorbing more uncompensated costs will be difficult. Without action, child uninsured rates are expected to continue rising. We should address this problem now before it gets worse. Second, drops in coverage create public health concerns. Legacy Community Health in Houston, for example, has been having trouble with children dropping off their rolls right at the 1-year mark when they should be getting their measles, mumps, and rubella vaccine. Their vaccine schedule is often delayed for months during an especially critical time for these toddlers. Without 1 year of continuous coverage, our managed care plans are also unable to fully measure quality. A minimum of 12 months coverage is required to compute most healthcare performance indicators. When we look at quality data in managed care plans, we are not getting the full picture, and this should concern us. And finally, continuous coverage has cost benefits, which should interest legislators looking to reduce the cost of health care, and we've included some of that data in our written testimony. We believe that everyone in this room wants Texas children to be able to thrive, but we can't do that if they lack access to basic health services. Aligning Medicaid coverage with CHIP's 12-month continuous coverage is something we've needed to do for a long time for our children, and we hope that this year we can finally get this done. Thank you.
Thank you. And just so I understand, so you would have a family would deal with a renewal every 6 months, but then also there are periodic income checks.
Yeah, it's a little complicated. So first in CHIP, we went to 12 months of continuous coverage in 2007, and that was near unanimous in both chambers. But Medicaid remained on 6 months renewal periods. When the ACA Act was being implemented, our state interpreted the rule. In the ACA, it said children cannot be made to renew more than 1 time a year. So now we have renewals at 12-month periods, but our state interpreted our state law that children would get first a 6-month continuous period of coverage, and then we implemented in 2014 new month-to-month periodic income checks. So families are getting their income checked a month 5, 6, 7, 8, and then the renewal, the check for your income for renewals usually starts around month 10. So any fluctuations, any mismatch with the electronic data causes a family to get reached out to. And this causes a lot of confusion. One family had a periodic income check that we worked with, sent in all their information. 2 months later, they went to the doctor, and the doctor said the child wasn't covered. Apparently, the renewal form had come in shortly after that periodic income check, asking for essentially the same information. They thought they just sent this in. and the child loss coverage. And we know that, these are working families that often work multiple jobs. The child we work with who has leukemia, his dad works in an oil rig on contract. So sometimes he has a lot of work and can do a lot of overtime, and other times he just has no work for months. And every time the periodic income checks, depending on which, if he got some overtime, they're having to fight just to keep their child on coverage. It's just a best practice for health plans, for providers, for families to let children get at least 1 year of continuous coverage. And, there's cost benefits to it, there's health benefits to it, the list goes on. And we hope that it's something we've needed to do for a while. And it used to be very, very expensive when we were at 6-month renewals. To go to 12-month, if I remember correctly, had maybe a $200 million price tag to it. But now, because of the way the system is today, it's far, far smaller, and we're just so close to being able to provide children the continuous care that they need.
Got it. Well, thank you, doctor. We appreciate you being here and explaining that
Yes.
to the committee.
Thank you.